Hey everyone, I'm John Hammerly with the Plastic Surgery Channel. The great news is people have gone through bariatric surgery. They have success stories. They've lost hundreds of pounds. They have new lives, new aspects of life. The problem is they have a little reminder. Usually, they have a lot of excess skin. Removing it, it's a difficult surgery. Is it life-changing? What do you think, you guys?
Well, I do think it's life-changing. It's one of my favorite types of surgeries to do, is to operate on massive weight loss patients. I think the hard part for the patients is that it's a process. It's not a one and done deal because you usually have excess skin in multiple areas.
Yeah, and it's also kind of fun because every patient is a little different, right?
Mm-hmm.
Like, in some patient, their face was affected. Some patients, it wasn't. It's their breasts or their tummy. So they all come in different shapes and sizes. So everyone has to have an individual evaluation. And then, like you said, we have to make a plan. It's usually not a one stage. And so we have to put a logical plan together. Hey, with their input, let's start here, then we're gonna go here, then we're gonna go here. And they have to understand that. But there's other challenges that come with bariatric patients as far as their long-term results and their nutritional.
Their nutritional, well, they have to maintain their nutrition because part of bariatric surgery, the way it works is it's starving you to lose weight, basically. So your nutrients aren't the same. And then also it's the whole process of maintaining that weight loss, because even if they've had surgical weight loss, not everybody is as successful with the long-term maintenance, and that's really important. It's a life-changing surgery, and the skin removal is life-changing, but you also have to change your entire lifestyle.
Right, and it's interesting because when bariatric surgery became popular a decade ago, and they were doing more aggressive types of, the gastric bypass. Now they do a gastric sleeve,
Mm-hmm.
which is, those patients, we used to say, well, you have to have 2 years of stable weight loss, right? We've now kind of cut that back to 6 months. So you're right, we have to kind of monitor that, see where they're at, see if they're stable. But I think one thing that we have to really communicate with these patients is that these patients, because of their nutritional status, sometimes their tightness doesn't maintain as long. And so they need to understand, since they've kind of gone through the weight loss, and maybe if they've had a gastric bypass, they have nutritional deficiencies, they're not gonna heal and react the same way as someone who just had children. And they may get loose again, and we may have to come back and touch up a tummy and tighten it up again in the future.
Well, the skin's removed, but the elasticity to that skin has been permanently lost. Because these patients, it's like the rubber band that you keep on stretching and it can't ever bounce back. So that skin has zero elasticity. So we remove it and get a great contour, but still, especially with breasts or something like that where you're using breast implants, with time, everything just drops again. And so that is something to understand, is that their skin quality is not the same.
Thank you very much. Appreciate it. For more information, go to theplasticsurgerychannel.com.